Your mind will answer most of the questions if you learn to relax. And if you don't learn to relax, you will have to wait for the answers to relax. Today, we are talking about job layoffs, we are talking about pay cuts, today, we are talking about physical distancing. And this is a time when we are forgetting about the positive balance of stress or distress. Today, from Rudy, we have curated this wonderful panel where we are going to talk about de-stress in distress. I am Moushumi Pal, founder of Woodpecker Media, and also the co-admin of the group Your Health in Your Hand. I'm sincerely obliged for Rudy to curate such wonderful live sessions every week and touch base on such important topics which have been taking so much of attention these days. I would not take more time. I would like to welcome each of the panelists who will bring in so much of interactive discussion today. And I would like to start with Dr. Manjiri. Dr. Manjiri? Yeah, if you could just unmute yourself. Dr. Manjiri, if you could unmute yourself.
Yeah. Hello. Thank you for inviting me here and having me here as a discussant. It's a very important topic, and thank you for taking this up.
Thank you so much for taking time out, Dr. Manjiri. We'll have a good discussion. I look forward to some helpful, answers from you. We also have with us Kiran.
Hello, everyone. Good evening. It's great pleasure to be here with you, and I hope I can contribute some great insights.
Awesome, awesome. We also have with us Dr. Bhavi Mody.
Hello, everyone. It's a real pleasure addressing you all today and having a panel discussion on de-stressing in times of distress. It's something very close to my heart, and that's why me and Moushumi thought that this was an apt topic to discuss in this testing times for today. Thank you so much, and we look forward to some great discussions and some great questions from our viewers.
Thank you, Dr. Bhavi. Thank you so much. And we also have with us Smriti. Good evening, Smriti. If you could just introduce yourself.
Hi, my name is Smriti, and I'm the lead psychologist advisor. I've been a mental health practitioner for the past 18 years. Been in touch with Dr. Bhavi for the past couple of years since I moved to Pune about 2 years. And I'm very thankful to her that she organizes these wonderful discussions via text and also, on video. So it's a great way to reach out to a larger audience. And,
Thank you so much, everyone, for taking time out and welcome once again. So today we're talking about, not feeling well, pay cuts, physically distance, when you can't go to parties, when you can't meet friends, your maid is not coming. There are so many things which we have to juggle. And also what's happening is we can't primarily forget about our work. So if we are working people, our work has doubled. If we are homemakers, our work has doubled because people are at home. There's so much of calling. And we say, there's distress, I'm stressed out, I'm not feeling well. So these are very commonly termed when you pick up a phone and you say, acha nahi lag raha hai. So in such a situation, I would like to bring in notice to a very important question, because today, if you see, there's so much article, there's so many people on different platforms talking about mental health. And, no one can be better than you guys who are practitioners, meeting people, patients day in, day out from various kind of fields, and to bring in that kind of thing. What is mental wellness? What is mental health, which people are trying to address so much? I would like to start with you, Dr. Manjiri.
I like the term mental wellness a lot. I'm a psychiatrist, and often when I say I'm a psychiatrist, eyebrows are raised. But I think the whole concept of mental health has changed. Psychiatrists, mental health professionals nowadays don't only cater to mental illnesses, but we're also promoting mental wellness. So, what exactly is mental wellness? I think it's a capacity where each of us is living to the full potential. We're able to tolerate some amount of stress, as in make the best in times of stress and adversity, and of course live a happy, meaningful, contented life. I think that's mental wellness. So if I ask this question, I don't know how many of us are in that phase yet, but yes, one aim is to get everyone in that phase.
Yeah. So nice. Smriti, would you like to add your bit, please?
So often when we speak of mental health, people look at it as absence of mental illness. So mental wellness or mental health is not just absence of mental illness, but also being able to cope with one's stresses, being able to bounce back if there's been a low phase, and just being able to, adapt to daily changing scenarios, specifically crisis scenario like right now, is a test of mental wellness for sure.
Okay, great. Dr. Bhavi, if you could share with us, what is mental wellness for you?
Okay, so generally, when you look at people talking, everyone talks of illness and we talk of wellness. So it is simply replacing that I with the we, but is it that simple? No, it is not. So basically, according to me, when your mind, body, and soul are in a balanced state of mind and you are able to perform your optimum at your optimum level is what wellness means. And in general, if we don't talk of mental wellness and just wellness, we all think of spas and treatments and stuff like that. But wellness is actually all about you. How I feel, how am I feeling today? What is it that is bothering me today, or how am I able to live my life every single day? Is what wellness means to me, and that's what I promote to my patients, that it has to be like what is you. So for example, when people come to me, they come with a load of reports, ये टेस्ट कर लिया, वो टेस्ट कर लिया, सब कुछ कर लिया, रिपोर्ट सब नॉर्मल है डॉक्टर, लेकिन आई एम नॉट फीलिंग गुड. Then what is that? Then that is not wellness. So you have to look, when you say wellness, you have to look beyond illness. You have to look at the mind, body, and your soul and see how you can bring the three together to have a balanced, meaningful life.
Very good. Very good. And Kiran, if you could also share your bit.
So, for me, when I have to talk about mental wellness, it's as simple as how well we can handle our daily hassles, and whether we are even satisfied with the way we are handling those hassles. Sometimes there's a lot of self-doubt. Oh my God, I may not be able to do this right. Maybe I am not doing it right. We start comparing ourselves with each other, not realizing that we have our own individual differences. We have
Correct.
our own individual personality. So for me, I just see it very simply: how well can you manage your life and how satisfied you are with it? Because I think if you are satisfied with the way you're living, you're going to be doing great. The minute you actually start, you start doubting yourself and you start hoping that you would be at a different place, you cannot get there because of the differences that are there and your barriers that are there. So you're not even you're not even enjoying what you have, and you're running behind something that you don't have. So that's how I.
Well said. Well said. So, basically, the human body is designed to experience stress. And, stress can be positive, stress can be negative. But unfortunately, nobody talks about stress, which is the positive stress. Everybody is talking about de-stress. I am stressed because ye nahi ho raha hai, ye nahi ho raha hai. So much of negativity. We've always associated stress with distress because you don't know how to handle. And so beautifully you guys have put that if we are able to control how we think, if we are able to control the reaction which is happening, it's definitely in our hand to cope. You don't have to have 20 reports done first before introspecting what is it that is missing. So that brings me to Dr. Bhavi. You always talk about mind body balance. I've been with you on so many things, and mind body balance, what does it actually mean and how does it help us when we are talking about stress relief?
I'm sure all our viewers are aware that whenever we are doing anything at Buddhi, it's always a mind-body balance. So what do we mean by this mind-body balance? So in my 25 years of practice, Moushumi, I have seen that 80% of cases coming to me are psychosomatic. So somewhere your thoughts, your feeling, your actions, your emotions start working on you, and that's how your psychoneuroendocrine axis gets malfunctioning, or rather the constant stress that you're generating with small daily things. It's not something like you're taking a stress ka topla and putting it on your head, or you're wearing a hat of stress, but it's the small little stressors that mount up on you, and then they start working on your endocrine system maybe, or at some other level, like you may get migraines, you may get a thyroid, PCOS is very common nowadays. So you see these patients coming to me more frequently. And when taking their history, homeopathy is all about an elaborate history. So you enter into their, mental state, and you enter into their life situations, and you enter into their relationships with people. And that's where you understand that these stressors have somewhere caused these ailments that have come up. And 80% of the time, I see a distinct relationship that this was a period of stress in their life, and this is the ailment that has come up to them. Like I just took a case of a 70-year-old lady yesterday, and she had diabetes. And when I asked her diabetes जब शुरू हुआ तभी आपके घर में situation क्या था, क्या हो रहा था, and she comes up with a whole story of a joint family issues and how they were contemplating that they should all separate out, and they have to now live for their families. And that was a stress to that lady because she didn't know whether she's doing the right thing or not, and that's when diabetes came in. So I'm not saying that diabetes is not because of malfunctioning of the pancreas, but your thought, feeling, and emotions definitely work on your body. You cannot separate your mind and your body, saying that mind is separate and body is separate. They are not two different entities. At some point, they have to be balanced, and they have to be in sync with each other. So whatever you're thinking, whatever your actions are, whatever your emotions are, definitely play a huge role, and that is how you will come up with some or the other illness. So if you want no illnesses, I think this panel is going to help you how not to get into illness phase and stay in the wellness phase.
Awesome. So, coping with stress is a very important thing. And I think you guys will be able to bring in that value in terms of how to de-stress instead of, being in distress, because it's purely in our hand. Yes, I'll come to the thing where we will talk about clinical aspects of it, whom to reach out and what. But a very important thing which I want to touch base here is we talk about psychologists, we talk about psychiatrists. There's a dilemma when it comes to my mind, because people are always confused about psychologists and psychiatrists, because the moment you hear psychiatrist and you have to visit a psychiatrist, you feel log kya sochenge, what people am I mad, lot of conditioning which it comes to. So Kiran, I would want to know from you that how is a counselor different from a psychologist?
Okay. So I'll start with telling you about the basic duties and of a counselor, and then I'll go to a psychologist duties. I'll just give you a brief. So basically, counselors are people, are individuals who can help, who work with uh, individuals, couples, families, and they not necessarily they do not focus on clinical issues. A psychologist would focus on clinical issues, and they would be able to evaluate better. So that's like the main difference that would be an important one.
Yeah. So, I am going to a counselor to talk my heart out. I need somebody who will hear me out is very different than somebody who's going to treat me. Somebody who's going to provide
Yeah.
me treatment or solution. So that brings me to Smriti, that, I'm not feeling good. I'm in a low phase. Today, I'm not in that good mood, is something very relevant right now, because we are trying to adapt to the new normal. We've kind of convinced our mind that corona is going to be here. We will be under 50%, 70%, or 100% lockdown. This is how life is going to be for the few months. So we're trying to adjust or adapt. But what happens is, when do I actually reach out to somebody when I'm really not feeling well? That's something which I would want to know from you. Which is that time when you can actually judge that it's not about picking up the phone and talking about यार maid होती तो बहुत अच्छा होता, इतना काम नहीं होता है, but actually addressing your internal thing that I'm not feeling well, and I think it's not the phone call to my friend, but I need to reach out to somebody who can actually give me a solution. How does somebody pick up that judgment?
Yeah, I think it's a very relevant question in the current times. And also, I see so many people, whether it's psychology background, not psychology background, giving loads of advice everywhere on all different platforms. It can confuse people. And continuing from where Kiran left about the difference between psychologist and counselor. So counselors, you can reach out to a counselor even when you're struggling with a daily level stress. So it's something where I'm feeling that there's a barrier and I can't cross it. For example, I just can't get my mind over the work life balance. I'm not being able to address, uh, get adjusted to this new routine of working from home. What do I do? So that's the point. Maybe you can reach out to a counselor. But if you feel it's starting to affect your sleep, it's starting to affect your appetite, it's starting to affect your like the basic rhythms, that like Dr. Bhavi also said, the mind body balance, you start seeing both aspects being affected, that is the time when you need to reach out to a psychologist. Either ways, counselors and psychologists are both attuned to each other's work area. So even if you reach out to a counselor at that point in time, or maybe even to a psychiatrist at that point in time, they can always escalate it to the relevant person. So it's important that you reach out to a professional, irrespective whether it is a psychologist or a counselor. At that point, reaching out to a professional who is a mental health professional would, or somebody who you trust, a medical professional that you have been reaching out to, share with them that I'm feeling like I've tried everything that I know, I've read, no self-help is working, and I just can't get over it. It's overwhelming. I'm constantly having ruminating thoughts. I am unable to sleep properly, or I'm having disruptive sleep. They could be worried about loved ones, that they would get COVID, or somebody would get. So if it's getting too much for you and you realize that nothing is helping, you've spoken to friends, just reach out to a trusted health professional, I would say, broadly health professional. And I'm sure any of us would recommend then to go to the next best help that they should seek. So if I feel my client needs medication, I would refer them to a psychiatrist, or maybe to Dr. Bhavi. And if they feel that, okay, no, they need counseling, or they need cure, a treatment in terms of depression or anxiety, they refer it to a psychologist.
Thank you so much. And I love the fact, which I've been trying to pick up, that there's so much gyan available today to read out.
Yeah.
Everybody's talking about either, I'm not feeling well, related typically to mental health issues or mental well-being, and then connecting it to anxiety, and then jumping to suicide. And what is happening is that this entire vicious 360 circle is actually stopping relatable people to reach out to specialists. Because you feel ki if I reach out, or if I'm trying to get into or investigate into further, knowing that which bracket do I fall in, whether a counselor or a psychiatrist, people will assume that, okay, fine, I'm gone case, or there's something definitely a problem. So that brings me to you, Dr. Manjiri, that how easy or difficult is it to convince your own self, and how are these boundaries? Because you may feel that if I'm picking up the phone and talking to my friend, not about the, asking help, seeking help from her or him, but talking to him about going and reaching out to a psychiatrist, or probably taking an appointment. The friend would, instead of telling you that, okay, go, you should may probe into 20 more questions, which is basically your job. So how easy or difficult is it? Because people are, before they reach out to somebody like you, Dr. Manjiri, what are the barriers they need to actually cross is what I want to draw my notice to.
A very good question, and I would take it from the previous speakers, Smriti and Kiran, and that's truly, that's exactly what happens. I'm a psychiatrist, so there are a lot of myths associated. Like I said in the beginning, when I say I'm a psychiatrist itself, eyebrows are raised, but that's not the truth. In today's times, you can't be thinking like that. There is so much about mental health awareness. Psychiatrists are not only treating mad people. There's a whole lot of gamut that we do, including promoting mental wellness, not only illness. And we do not only give medications. We are also trained in counseling, and medication is something that we use at times, but it's not necessarily lifelong as most people think of it. Again, yes, before people reach me, actually, I think they have kind of crossed a lot of barriers, including black, religion, God, black magic, everything has been crossed, and that's when they come to me. But I think times are changing. I do see, especially in the youth, reaching out directly to a psychiatrist. But the first question when they come to me is, doctor, will whatever I tell you be within us? And of course, I give them the confidence, yes, that is. But doctor, are you sure that you will not tell anybody that I have visited you? Then if I ask them what the problem is, I don't want anybody to know that I'm visiting you. I do need to visit you, but I don't want anybody to know that. So I think the stigma is still very much there. It will take some time to, get rid of the stigma. But yes, awareness, talks like this is the only thing. But I think before a person reaches a psychiatrist, I'm sure they try in their own ways. But when they understand that it's not helping and it's reaching a point where I'm becoming dysfunctional, where it is affecting both my professional, my personal life, and my biological rhythms like sleep and appetite are getting affected, or some good friend or a family member tells them that yes, you need to reach out to a mental health professional. And I think definitely times are changing, people are more educated and aware, but I think we still have to do a lot more to break the stigma.
Yeah, very good. Yeah. So I think this, the stigma associated to it is huge, and that's something which is actually stopping people to reach out to the right, help which they can do. And also, very important thing is, I think people like you guys can help people to identify the stress triggers, because recognizing the stressful reactions which is happening is a very important step before you even go to manage stress. Because if you have not identified, then the next step wouldn't even happen. So that's something very important. So Smriti, you are a lead psychologist at Visa, and I'm sure you're dealing with a lot of corporate clients. And today, when you see there's such a juggle between the entire professional hazards which we are going through, how common is it for them to reach out to you for solutions? And actually, how do you help them to, what's your approach? Is it a blanket approach, or it's a personalized one? What is it that they actually look at?
So I'll briefly tell about Visa very briefly. It's a mental health. It has 3 layers of support. The first is a mental health chatbot. The second are tools like mindfulness-based exercises or CBT exercises to help reframe thoughts, etc. And the third layer is the therapy support that I own, and I have a team that runs it. And it's anonymous. It's discreet. So we do not get to know that the people are coming from a certain location, a certain office, a certain organization. So anonymity really brings people up and talk. And then it is text-based. It is chat. It's not video or audio. So that even opens up the channels even more for people to kind of, you can be sitting in a cubicle and chatting, and it appears you're chatting to a friend, but you're really chatting with a therapist. Okay. So that kind of has encouraged a lot of people to reach out in this phase. We have seen our numbers go up from almost by 50 to 70% in terms only post-COVID, only post-Feb or March. And they're still continuing. And a lot of people who are bringing in work-life balance. So we get to know, or maybe they could be founders who are struggling with how to pay their employees. Or they could be, employees who are struggling with pay cuts or a fear of job loss, which is about to happen. So I have a particular client who recently was reeling under this pressure. And even before the company could tell this person or take that decision that, you won't be continuing with that, the person resigned. Because they said they could not take that pressure every day I would wait that today would be that day. And they did not consider that there could have been an option where they wouldn't have been told to resign, and maybe, there would have been another option of shifting them to another department. But the anxiety and stress was so much that they resigned, and they said, I'd rather utilize this time to calm down and maybe, equip myself better for another option. When things are better with me health-wise. And this is a decision which we reached together. So when we saw that they were constantly struggling and it was not working for them, it was affecting their sleep, appetite, the news was still far away. We didn't know whether they would receive it or not receive it. And so it's very customized. There's no blanket approach. The blanket approach comes in times when we are using psychoeducation to tell them what's happening. For example, the stress response actually is a survival response. It's always there within us. And in the early days when we were in caves and there were tigers, the stress response was there to help us either run or hide or freeze. For example, if there's a bear, they say you usually freeze, so the bear sniffs you and goes away. So these responses are protective responses to help us. But now there are no tigers and there are no bears around us, but there are these kind of threats and how we perceive these threats. So when we are educating them about stress triggers, how my trigger would be different from your trigger, but the reaction could be very similar. We may experience breathlessness, we may experience rapid heartbeat, we may experience worry thoughts. So that remains same, but maybe the strategies that may work with one particular individual may not work with another individual. So with this individual, we saw that they had a good amount of saving with them. They could afford to leave that job at that point in time and focus on their health. So it could help them kind of relax, calm down, deal with the stresses, and then maybe look for another job. It may not have worked for someone who did not have that kind of savings, and we may have taken another approach to deal with their concerns.
Okay, interesting. So, do you also talk to them personally about exercises, some form of exercise or meditation or
Absolutely.
calming?
Yes.
Because it's all about
Yes.
anxiety, needs some kind of
Yes.
calming approach. So, do you also talk to them
Yes.
about that?
Yes. So it's a holistic approach that we bring in, because the mind-body relationship is very unique. Everything. So even our food affects our moods.
Yes.
Or we eat to calm certain kind of moods that we are in. Eating something can make you happy, or the weather around us, the cool sensation of the wind on the skin can make you feel a different way. So we address it holistically. So there are exercises which we teach them to notice with changes in physical sensations, which could accompany the thoughts. So that is used as a cue, and deep breathing is introduced at that point in time, or mindfulness breathing is introduced at that point in time, to recognize that, okay, now my heartbeat is racing or my pulse is beginning to go faster, and it means I may be about to spiral into an anxiety attack. And that's the time when I have to bring in deep breathing. But because these are skills, these need to be practiced every day to reach that level where you can bring it up naturally. So working on helping them set a routine, and a routine with exercises or relaxation exercises weaved in. Also, we talk to them to consult a doctor if they need sleep medication for that particular point in time. So there is no stigma. We have stomachache, we have a Digene. There is no stigma about that. But when we need a sleep medicine, it suddenly is like a big demon that, oh my God, I've lost it because I need a psychiatry medication. So we encourage them to go and seek more support from a nutritionist, from a physical fitness expert, etc., that could help them in that point in time.
Okay, great. Thank you so much for bringing in such a detailed, thing for our viewers. Also, I'm sure it'll be helpful. So we are all trying to juggle and set our foot into the new normal, where digital consumption has increased. The online, laptop, phone, everything has increased so much. And I think apart from adults, children today are facing it. I think more, because they are spending more time. So it's so confusing. Earlier, as parents, we used to say, or as education, we used to say ki school mein phone leke mat aana. But now we are telling them online school, give them laptop, give them iPad, give them phone. So it's so contradictory. Dr. Manjiri, you deal so much with children, and your patients are mostly children. So would you like to share with us how easy it is, or how has it affected with these online classes for children? And what's your take? Where should one actually draw the line?
Thank you so much for that question. It's something that has been bothering me so much over the last few days and the last 2 months. And I've got umpteen number of calls and messages from parents, teachers about what is this. So first of all, I think this is something that we have to accept. It's something that I don't personally agree to, but I think in the current scenario, online schooling is going to happen. But the most important thing for us to understand is it is temporary. It's not going to last forever. When we think of online school, parents are scared, teachers are scared, students are scared, mental health professionals like me are scared. But yes, this is going to be temporary. After a couple of months, we are going to go back to our routine school. Second, there are some, obviously the older students will need it, because you have to keep your academics going, to run your curriculum, it's going to need it. So parents have to take certain precautions. What I would say is, if your child is having online school, accept it. Don't crib about it. There's nothing much you can do. Obviously, if your child is less than 5, I think it's ridiculous. But I think if your child is over that and it's an educational thing, you have to accept it. have certain rules in place. Explain to your child what online schooling is, why this is being done, and that this is being done temporary. I think this is double homework for parents, because parents of smaller children will have to kind of monitor their children and supervise their children, because I have got cases where the child is doing everything but attending online school at the time of school. I mean, multitasking, having multiple windows open. This does happen with older kids, so parents have to be careful. One good tip that parents can follow is that have the child not on a phone, preferably have the child attending school on a laptop or on a computer, and have it in the living room. Advantages is the child is not alone. Take away the child's phone during that time, because he's on the screen, so try to make sure that the phone is not with the child, so that the child can't do other things, because that the screen time has increased. Ideally, our guidelines say less than 2 years, no screen time, 2 to 5 years, 1 hour of screen time, and 5 to 10, 2 hours of screen time. Obviously, this has gone for a toss. So, other than your child's educational school time, try to minimize all other screen times. Encourage, other things during this time. Immediately after the school ends, like say 2 o'clock, your school has ended online, at least for 1 hour, no more viewing of any kind of screen, because it's ophthalmologists are also worried about the side effects of children's eyes, and I've got a lot of reports of that also. And yes, if your child is slow, if your child especially has special needs, because I cater to a lot of these children, it's going to be very difficult for your child. It's not a rat race. If your child doesn't do well in these 2-3 months online school, he lags behind, it's fine. This, we tend to tell parents, try to focus on life skills. And I think this is the best time that parents can utilize to teach children, and schools especially can focus not on core academics, but try to focus on life skills during this period. So, and also at the same time, know that teachers are burdened. I've spoken to teachers and they're like, we didn't know how to do this, but we are doing it. And it's so easy for a parent to say, Arey, what is this teacher teaching online? She doesn't even know how to appear online. Teachers don't know. So, be kind and compassionate to yourself and to your teachers as well. And one important thing is try to maintain that kind of routine. So if your child has 8 o'clock school online, on an ideal day, your child would get up at 6:30, get ready. I've seen some parents now 5 to 8, they wake up the child and in his pajamas, the child is attending school. No, that is not school. You wake up the child at 6:30, get him ready, have a bath, wear the uniform. I think this is so important. You wear the uniform so that the child feels that I'm going to school, and then make him sit. There'll be a lot of seriousness that will come, and obviously the productivity will be more. But like I said, it's not going to be permanent. This is temporary. Don't expect your child to excel. It's okay if he doesn't. Be kind to yourself, be kind to your child, and be kind to the teachers who are putting in all this hard work.
Thank you so much. So I'm a little inquisitive, I'm a parent of a teenage boy, and judge me. So I am really intrigued to ask you this question, that how do you actually curb that screen time? Because yes, your child is doing almost 6 hours of school, which is laptop, and the school is giving online homework also. Now the child has already got, into the hang of doing a laptop based learning and online where there's no pen and paper. So from psychiatry perspective, I want to know, how easy or difficult will it be to get them back to the normal routine? See, today we are saying that we will go back, but if you see, we are trying to get this child adapted to a normal learning. And again, the child, it's something which is confusing. So how will it be? If you could share a little more about your take.
We are worried that the mental health surge is happening right now. The anxiety, the depression, all is happening now. It's true. But I think the higher surge is going to happen when the lockdown ends and we get back to our real life. And as a child psychiatrist, especially, I'm more worried about kids. They've got so used to this lack of structure, doing whatever they want, online schooling. Trust me, the attention span is so badly affected when the kids do everything online. When they get back to real school and they have to do it in their books, I think the writing is gone for a toss. The motor coordination is gone for a toss. Their attention concentration is gone for a toss. Smaller kids need sensory. They do learning via sensory methods. They use all their senses. This is not happening when you're doing online school. So you can expect a whole range of emotional and behavioral problems once school starts in reality. So I think just few days before when the school actually starts, there is going to be a whole lot of preparation that will have to be done. And yes, we will have to know that 1 month after school actually opens in reality will be more challenging, and parents have to brace themselves up. One good thing, I think teenagers, a lot of people always say, oh my God, I have a teenager, it's a very difficult period. I do agree. But I think one thing about teenagers is you really sit them down. I mean, I'm saying this confidently because I deal a lot with teenagers. You just give them the confidence that you're listening to them. You're setting a rule, but you're telling them why you've set the rule. So, authoritative, not authoritarian. That kind of a discipline you have with them where, you sit and discuss the schedule with them rather than setting a schedule for them. Like for a child, you'll set the schedule. But for an adolescent, sit with the child and discuss it. Have the schedule with the adolescent's perspective in mind. Discuss the ill effects of screen time. Today's children, because of the flying effect, their IQ levels are definitely higher than the previous generation. They can understand a lot more. And trust me, if you speak out to them and you help them to express what they are thinking, what their views are, I think it's going to be much more cooperative and smooth with your teenagers. It's just about open communication with teenagers.
Yeah, that's helpful. And when we are talking about kids, as parents, if we are stressed, how do we help our children to remain calm? So I come to Kiran with that if I'm a parent who's stressed about the do's and don'ts and not able to handle it, what are the strategies actually can you use with children when you have to create that kind of a calming effect with them? Because see, today we are trying to give them all kind of facts and relative story that why they can't go for the physical activity. But if you see, children are the worst hit because they meet more people in a day. Typically from starting their school in the morning, when they go to the bus stop, meeting so many children and the buzzing noise, then they move to a school, the classroom, their dispersal, and back home playing, so many people. And today we have confined them, and most of us with nuclear family, what is happening is they're only seeing two parents and themselves. So they're not able to emotionally even express. Whatever they're doing is very limited. I feel with my own parenting also that yes, we are trying to do quality time, we are trying to talk, everything fine. But somebody who is in a nuclear setup vis-a-vis somebody who's in a joint family with dada dadi or maybe some cousins around, that child must be in a very different set of mindset. So as parents, how our anxiety or how our calming helps to strike a balance with children?
So yeah, I think parents and family are the greatest and the major factor when it comes to this, and they are the role models, as what we can say, because if they see you handling your work, they have to handle their studies. If they can learn, and if they just see you doing it with the ease that you actually do it, if you can make them realize that you also go through the same stress. It's nothing different that they're feeling, we all experience it. It's just that we all have our own ways to deal with it, and you may get an option to take a day off, and they may not because they have some assignment to complete or they have to have the attendance. And same applies to you. There are days when you are attending work even when you don't want to or you cannot. It's like you have a rough day too at work and they have a rough day too at school. So just even if it means just explaining to them, just talking about it casually, it's just going to create a better connect for you, and they'll realize that as parents you are also going through the same things, just that the situation is different. And then telling them how you would have coped in such a situation, giving them ideas, I think that is something that is really works, because eventually if they see you getting irritated when you're stressed, they will also probably just be that way. If they know that you could take time outs as experienced adults who are in that whole phase where we have seen life and all those kind of things. When we know, if they understand, timeouts are a good thing. I think, like, when you can't take it, just 5 minutes for yourself, and you can get yourself going again. You don't need to be sleeping all day, but you can have 5 minutes just for yourself, drink a glass of water, and also come back at times. So that also works. So these small timeouts and discussing with them your strategies, what you went through, is something that will increase the connect with you, and they will understand the good and healthy coping strategies rather than getting into the unhealthy strategies.
Thank you. So effective communication is something which is so important. And I think, as parents, sometimes we build that aura around us wherein we don't even know how actually we should help our children, because they are seeing us as role models. But if we suddenly show them that yes, there are ups and downs. It helps them because they also take life more normally in terms of understanding that yes, life is only not about all the good things. There are challenges also.
So they wouldn't feel targeted. Like, it's not that they are
Yeah,
the only target in our life.
yeah,
I
very
think
good.
that is an important thing too there.
Thank you so much. So, Dr. Bhavi, I would want to know from you that how does homeopathy actually help in mental health, disorders, in anxiety, stress, or do you say that only homeopathy works, or you also advise people to seek counseling along with medicines?
So yes, definitely homeopathy does help in mental health disorders. But again, as I said, it's a holistic approach. As it is at Vruddhi, we always believe in a holistic approach. So first and foremost, whether it's a physical ailment or a mental health illness, what we advise to our patients is first that you need to have certain lifestyle changes. When I say lifestyle changes, it means that you need to take care of your sleep habits. You need to set a routine for yourself, wake up at the same time, sleep at the same time. There's a study which shows that most of the Indians have less than 6 hours of sleep, and
Yeah,
when you're not sleeping well, definitely your entire cycle circadian rhythm goes for a toss, and then you are at risk for a lot of lifestyle disorders like diabetes, hypertension, and sorts. So sleeping
yeah,
well is something that we advocate for it. Second, that you have to be very mindful of whatever routine you're setting. So if you're going to be exercising, you have to see that you set some time apart for your exercises. Now you may say, I can't go to the gym. Okay, but if you can't go to the gym, you can do a Leslie Sannon work at home, or you could work out at home. So there is always a replacement. So look at options and have a set routine for your exercise also. Third thing that we generally advocate our patients when it comes to stress and anxiety is that you are the most important person for yourself and for others. So if you are not healthy, your family is not going to be healthy. So you have to give that importance to your own self. Treat yourself like you treat others. Don't you treat everyone with a smile. So if I look at you, Moushumi, the first thing that I'm going to do is going to smile. So I always ask them to begin their day looking into a mirror, smiling at the beautiful person that they see opposite themselves. Hug yourself tight and say, I love you. Self-love is not being selfish. It's very, very important. So this is something that you need to train yourself to do, because over time we have always been taught to put others first. सबकी
yeah,
नीड्स को पहले रखो, अपने आप को बाद में देखो. Like I remember during my mom's time or my grandmother's time, it would be that men of the family will eat first and they will eat last. जो बचा कुचा है वही खाएंगे. Now things have definitely changed, but now it's time that we understand the importance of our own selves and keep ourselves healthy and happy, to keep our families healthy and happy. The next thing that we advocate at Vritti is definitely nutritional guidance. Howard has come up with this term of nutritional psychiatry. So definitely food has a very, very important role to play on your mood. So, chocolate तो क्या होता है? सबको खुशी होती है. अरे chocolate, it's like a mood buster. So you have to identify food and what effect it has on your mental state. So, figure out what is it, how you are reacting to those kind of foods. Maybe some foods are comforting to you, some foods maybe not. So try and find out that, and we then plan their meals that way so that it helps them. That is what we do. Again, coping strategies and mechanisms are very, very important. I like this app called Calm. I mostly ask my patients to download that because it has very soothing music. Like Smriti was mentioning, mindful music is there. There is something for deep breathing. There is something for exercises. So there are very wonderful music which you can, whatever music you could relate to, probably you could put that on and just calm yourself down. So as a routine, I ask my patients to do that before you go to sleep. At least 10 minutes spend, listening to some calming music, which will really, really help you. And one thing that I tell them to do is have chamomile tea. It's a great stress reliever. Though it's a tea, but it really works very well. So chamomile tea is something that I ask them to do. And yes, definitely homeopathy is prescribed because, as I said, homeopathy acts as on your mind and body both. So even if you're coming for a physical ailment, the medicine is helping you with your anxiety management and your stress management. And if you're coming for a mental health issue, it is definitely calming to you. So we have certain sets of medicine which works as a stress buster, or something that we can specifically give for stress. So we do administer those medicines, and then of course counseling, psychologists, they all come into place. So we had a center wherein we had psychologists, counselors, remedial teachers, autists, all coming and working together for children. So definitely a holistic approach is needed. So I would never shy out from telling my patients that you need a counselor, or you need a psychiatrist, or you need a psychologist. So at times homeopathy may not be able to help the patient. That's when my patient will definitely go to Dr. Manjiri. And I know when I need to send my patient to the next person, because if I'm not able to manage, ultimately the patient has to be managed. So that holistic approach has to be there, whether it's allopathy, homeopathy, doesn't matter. Just doesn't matter.
Very good, very good. So I think we've pretty much covered most of the question. Now I want to know from each one of you, wherein we know this pandemic has been so stressful. And when we talk about all the other things associated, which we spoke for so long, each one of us has been coping or trying to react rather very differently to these stressful situations where we are, and wherein we have so much of questions about what is there, the uncertainty in which we are living, or how do we take care of ourselves when we go out, to our workplace, what does it happen. So I would want to know from you guys, how does one identify these stress pointers apart from the generic thought which is happening, and also how does one actually cope, or what are those mental health ways, or tips rather, which you will give to the viewers, to me, about coping with stress right now. Because see, I'm sure each one of us has some kind of stress pointer, and that's the reason we curated this, where we wanted to talk about de-stress. But in the long run, if you see, we need to figure it out, whether we are where we started with March with uncertainty. Now we are already nearing July, and we don't know. So whether we are in that stressful situation, which is a day, topic, or are we nearing to something which is got into a more detailed thing, which is the worrying situation. So one is identification, and second will be how to cope up. Let's hear it out from Smriti.
So I would say all of us are vulnerable to stress. Just knowing about mind or studying about brain or knowing how body works doesn't protect us professionals also from stress or from illness. And then we are all in the same boat right now globally.
Yes.
And when we take the stance of acceptance that we are all in the same boat, and suffering is something which is right now in one way or another, each individual is in some way, like I know personally, Dr. Bhavi also knows that I'm really worried about my mother who's in Delhi and I'm in Pune. And I'm constantly ruminating and thinking about her health and about her condition. And personally, what I do is, and what people can do in situations where there is so much of uncertainty and unprecedented, is proactive coping, which is looking at what you can control and problem solve. For example, what can I do for my mother? From here, I can arrange for help. I can help connect with doctors. I can help her connect with help which is available. And then realize this is the best that I can do in this moment. Worrying about things which are out of control. So also identifying, imagine yourself, standing in the middle of a circle, and then there's another circle outside of it. So the circle in which I am is my circle of control. Anything outside of it is thing which I cannot control. But the thing important to remember is that if I'm able to control what I can have some influence on what I can't.
Yeah, true.
So focusing on self-care, which we keep talking about, and which doesn't end with just sleeping and eating. It is much more than sleeping, eating, and exercise. It is practicing self-compassion. Not, don't judge yourself for not doing as much work as you would want to, or losing anger on your kids. And I say it for myself, being a psychologist, I have some moments in the day where I'm losing my top off
Yeah.
because of things like you discuss, screen time going beyond, or class is on but YouTube is also on simultaneously. Children are doing all sorts of stuff. you know
Yeah.
so don't judge yourself for that, because these are not normal times. Just that acceptance is important. And acceptance in no way means giving in, that up to har gaye. It's not that we have given up. It is rather an empowering position to have when you accept, because then okay, now this is where I am, and from here I have to move on with whatever strengths I have, with whatever resources I have.
Well said.
Something else that also helps is a good winding down routine, because throughout the day we have so much of information load. Even if I am right now talking to you, I may have 20 messages lining up on WhatsApp. There would be something else lining up somewhere. So a winding down routine, learning to say no to self at the first position. You say no to yourself. No, I'm not going to pick up my phone after 9 p.m. or after 10 p.m. Inform your relatives, inform your friends. Create that boundary that this is my space. I need this time to wind down. And like then Dr. Bhavi said, have your chamomile tea and listen to some good relaxing music, play games with your children, that quality time that probably a lot of working parents may not be able to spend during the day with their kids, right? So these are
Yeah.
some things which I'm personally doing and hence sharing that,
Yeah,
I find them
that's the
helpful.
tip which we, actually want to hear from you guys, because, it's more relatable, it's more doable, because so we are all working professionals, we all have a family at home, and we all are going through some, cut pointers. So from you, I will take off that, that winding time, because that's something which you need to push. Because otherwise, when you go for a typically a normal working schedule, that 9 o'clock you have to leave home, very well 7 o'clock you have to leave from office, come what may, traffic hoga, ye hoga. Right now you have no starting time, and right now you also don't have a end time, and it's so very important to set that boundary for self. I think everything starts from us first, than moving to somebody else, because when we are talking about children also, they see us, and then only we can set that thing for them. Well said, well said. Kiran, what would you like to talk about, the personal tip which you are following? Or
I think I have been in this practice. It's a very childish thing that I do, but it's as simple as just coming online and getting some a game of Ludo with my friends. I think that is more than enough for me. It takes me back to my childhood. I'm doing what I used to enjoy the most as a kid, and it's the best, I think. And in that way, I am also connected with my outer circle, and we have those moments where we are happy, and we are in that is my break point, and it works wonders. It just like that half an hour that I'm on the phone, but it's working wonders with me. And that's something I like. I would just say ki if we have to do something, and if you need to self care, just find that one thing that really works for you and makes you happy. You just need those 5 minutes also of something that makes you happy is more than enough. You don't have to sit all day and meditate. It's like you don't have to do it constantly. You just need those couple minutes for yourself, and you should be good to go. And I also say that there should be you should find those couple things that which require least investment of efforts when you have to practice it, so that you can do it anytime you need it. you
very
you know you should have accessible things with you. So it's like you can just keep a chocolate with you also at times that also might just be your time out, and just eat that chocolate and then get back to work.
very good. Dr. Bhavi, if you can also share with us some tips to the viewers, where what keeps you always smiling, even in this lockdown, so many people are calling you and giving you their stress, and still you are smiling.
Yeah, so basically, what I feel is I am a big chatterbox. You know that, Moushumi. I love to connect with people and talk to people, and I have a good circle of friends. So whenever I'm with my friends, I'm my best. So now, social distancing doesn't mean social isolation. Okay. So we have this thing wherein we have scheduled calls. So we all get onto the call. So Zoom बराबर Zoom तो बहुत करे for profession. तो कभी Zoom लेते हैं with friends. So we have a meeting scheduled and we all get on Zoom just to laugh it out or just to chat, and it's like crazy, it's a crazy, but we are a crazy bunch of friends. And what we do on Zoom, if I record and share with you guys, you will say, Dr. Bhavi aise nahi kar sakti, but I do it, and we all do it. We just become children again, like Kiran said, and that's what keeps me sane and keeps me happy. So getting back to friends, and I have a wonderful social circle also when it comes to my masis and my cousins. We are a huge family, and again talking to them really makes me feel very good. So my children also often tell me, when you talk to your masis, it's like there's a different glow on your face. Ek chamak aati hai aapke face pe. But that's the connect that I have with my Masi. So whenever I speak to them, I talk to them, I really relax. So these are a few things, we have to understand that even though we are in a lockdown or we are unlocking gradually, when we can't actually go out and meet people, we can definitely meet people online. Dr. Manjiri knows when we get together on the Vibe platform, we are again having too much of fun, right, Dr. Manjiri? So she, these are things, basically I know that I like connecting to people, so I will do that. Like Dr. Dhaval, my husband, he is a little reserved, not reserved in a sense, but he likes to have time for himself. So what he does is, he will, have his essential oils and the diffuser. He will set up the mood, and, he will spend his half an hour in the room. And then that time he doesn't want anybody in there because that's his time. So we all have our moments where we find peace and we find happiness. So I think each to its own, and we should be doing that for ourselves every single day. Like right now, even when we are in the middle of this, I had a phone call from one of my best friends and I could just cut it. So the next thing after I end the session, what I'm going to do is pick up the phone and call her. So we should be doing that. And yeah, the other things that we all mentioned about setting a routine and, having our me time and self-love is all there. But sometimes you don't get time to do that every day, then at least something that you can do, you should be practicing every single day.
I'm sure. And I think part of lockdown has been that, yes, we are all talking about all issues, which lockdown has given us, but we have become so globally connected.
Yes.
We never thought that we will use online, apps to talk to our friends and we can family and spend so much time. Earlier, we would do a normal, call, and now we have like 1 hour schedule on chats, and it's so nice, basically, to see, each one of us making the optimum use of it. Dr. Manjiri, I would want to know from you those tips which you have been following.
Sure. One thing I can say is let's just accept that these are tough times. Let's be kinder and more compassionate to ourselves. I tell all parents, this is not the time ever. I mean, it's never the time, but all the more now, it's not the time to aim to be perfect parents, nor aim for your children to be perfect children. There are going to be difficult moments, accept that. I think the initial phase of the lockdown was very difficult for all of us, the sudden disruption. But I think we have to look at the positive side. We have to look at how this lockdown has helped us. Maybe spending more time. Like I have an 18-month-old child. I hardly get time with him, but I think this lockdown has given me so much more time with my child. So that's looking at the positive. One more thing is we have to accept that the past life is going to be very different from the new normal. We still want to cling on to the past, where we were having fun in restaurants and, clubbing, whatever. It's not going to be there for a long period of time. Maybe the new normal of meeting friends, etc. may still happen, but it will happen differently. So accept that the past is the past. Let's not keep living in the past. Let's just live in the present, because that's all that we have. And let's understand that this is a tough time for all of us. So we don't have to be perfect. We're all going to make mistakes, but accept it. And lastly, acknowledge and accept your feelings. Even if you're feeling sad, even most people say, oh my God, I can't be depressed. It's just not me. How can I be depressed? But mental illnesses, psychological illness do not spare anybody. Irrespective of your caste, creed, or the financial status, etc. Anybody, right from me, can, be affected with any of this. So just accept your feelings and connect. It's like Dr. Bhavi said, it's social distancing, but in no way is this social isolation. So connect more with people. That's the only way we have to keep our sanity going for the next couple of days.
Yeah, so well said. I think again, when we go back to the unlockdown and gradually everything said, we will have our problems then also. Then we will sit about worrying that, it was so good when the entire family used to eat hot
Sure.
lunch during the day, wake up late, and you had so much time. So we will continuously keep having something or the other. And I think the whole thing is about
That's why it's important to be present.
more resilient approach in terms of building up a community where we can encourage people to identify where you are not feeling well, to differentiate between getting clinically depressed and seeking for help. That is something which individuals like us can bring in, talk. I would just quickly, before we wind up, take one question. Dr. Manjiri, if you can address this. Kids don't use headphones when it's about teenagers. And how can no also, if kids don't use headphones, we can listen what the teacher is saying. So
Okay, if the kids don't use it, but it totally depends on your child. If your child is not comfortable using headphones, your child wants to listen on the laptop, I think that much trust we have to have on our children. I have a lot of teenagers complaining that their parents don't trust them, they spy on them, and trust me, that makes them feel distant from their parents. So learn to respect and learn their boundaries, learn to have, obviously if it's a teenager, they have to have, there are going to be certain boundaries. So if your child doesn't want to use headphones, it's okay. It's not important for you to know what the teacher is talking about, as long as the child knows. At the end of the day, the child is accountable, and if it's a teenager, he's very answerable to himself more than to you. So leave it up to the child, and let's just hope for the best. But yes, set certain rules, and these rules can be set when you discuss these things with your child.
thank you so much. So I think we've summed up a very informative, insightful session with each one of you making so much of value addition of talking about taboos or myths which we want to address, or probably lend a hand to be helping to go to that specialist or a psychiatrist, be it a counselor or a psychologist if needed, or be that friend who can hear out and help to discriminate that whether you need a friend or you really need a professional help. So I think we've really summed it well. Thank you, Dr. Bhavi. Thank you, Vrudi, for actually conceptualizing things like this, wherein we can touch base on more relatable questions. Because today there's so much content which is available online, it sometimes becomes very difficult to filter out. Because then, Smriti, you were talking about the corporate and you spoke about basic small things of layoff, which is triggering. It is so much of an important, or I think a great message to somebody who's actually going through the situation, can actually identify that, yes, I need to go and seek help because it is bothering me. It's not a one day affair, ki soch aayi thi, but it's actually an ongoing process which is actually creating or, disturbance in my mind. And I need to go and speak out to somebody, wherein, you spoke about financial well-being also. So, you can actually help the person identify whether you need to worry about it or you can drop it because it's something which is not important. So that fine line can be balanced only by having relatable conversations like this. And I think more we speak on issues like this, more we take out topic like this, and we'll be able to make a difference. Thank you again to each one of you to take time out, and it was a pleasure chatting with you guys. Thank you so much.
Thank you, everyone. Thank you so much.